So, welcome everyone at Trends and Suggestions. Today we are gathered together with a topic. The topic is harmonizing health, unraveling the genetic links to metabolic disorders, and integrating NLP hypnosis, CFT, yoga for diabetes prevention in the corporate world. So, welcome everyone. Whoever is watching live, will if you have any queries, please put it down in the chat session. The speakers will give you the answers later on once they finish it. So, before this, today is an International Diabetic Day. So I would, what exactly I'm just doing, I'm just introducing one by one. Okay, I will call each of the speaker first and I will ask them to introduce themselves likewise. Okay, like first I'm just inviting Rahul George. He is India's premier self-hypnosis coach. So I would request him to just to unmute himself and just tell a little bit about him to the audiences who is watching live and who will later watch it as a video.
So first things first, for those of you who are watching this live, and of course, if you happen to be watching this later as a recording, please do treat this time as being really important, that you were meant to get this message on World Diabetes Day. I've been in this space of personal development now for more than 2 decades, and it's my mission, it's what drives me to help people really be able to focus on themselves and to do whatever is within our power to be able to reduce stress, to be able to really build a lifestyle where we are aligned more and more each day. And for me, I've been very blessed that I get to do this through the power of hypnosis. So I'm really looking forward to this panel and a lot of the amazing insights that will be available for you, not only now, but you can always come back and watch this again.
Thank you, Rahul. Yeah. Over to Dr. Biju Kes, who is the founder and wellness consultant of academic director of Vigyan and head department of genomics, and he is working on longevity research for virus. So over to you, Dr. Biju. Yeah.
Thank you, Deb. As Deb mentioned, my name is Dr. Biju Kes. By profession, I'm a doctor turned management professional. I am doing both the profession as a doctor and also as a management professional, doing well with V-Roots. I'm working as a chief medical officer at V-Roots Wellness Solution, and also as the head of genomics department, where we conduct these genomic testing to get precise solutions for the problems of our client, and also working as the academic director at Vigyan Academy. That's actually the sister concern of V-Roots Wellness Solutions. So I have been in the space of medical science for the last around 15 years, and mostly I have been dealing with the lifestyle diseases, especially diabetes, obesity, hypertension, cardiovascular diseases, etc. Recently, I shifted, maybe some last 3 years after COVID, exactly from 2000 March onwards, I shifted my interest, or I can say included one more interest in my entire career, that is longevity, how we can increase our lifespan, to be more precise, a health span. So I have been working into it using the concept of genomics and purely into the science of longevity. So thank you. That's all about my present career, and also present my organization, about my work, etc.
Thank you, Dr. Biju. Now over to Subhavahini Sitaraman. Sorry for telling your name wrong. She is a diabetic coach. She is a certified diabetic educator, and she is a lifestyle coach and founder and CEO of URIMI Holistic Wellness Research Center. So over to you, Subhavahini.
Thank you so much, Devasmita, for introducing me and bringing me in this platform on the World Diabetes Day. It's really so precious for me to be here as the diabetes educator. I'm from a corporate person, being a project management professional. I have chosen to be the diabetes educator. I've qualified for it, and helping employees in the corporates who say they do not have time for making changes in their lifestyle to manage the diabetes well. I'm helping them with following the diet, lifestyle, exercises, and the mind related activities, integrating with medicine and yoga and nutrition. This is what is helping people out to bring their HbA1c levels down, and mainly they should just, first priority is like they should just come out of the complications, and or they should not be even getting into complications. And people who are not diabetic, pre-diabetic, they should just come out of it. Prevention. This is what the work that I'm doing as a diabetes educator in corporates for working professionals. Thank you, Devasmita.
Thank you, Subhavahini.
Yeah.
Over to Ankit Vijay Bansal. He is a director of Space Orient and he is an automationpreneur. And he inspired me to become this automation, because this is something trained. Even me and Subhavahini both are into this profession as well. We are doing a part of the Subhavahini is also into automation as well. So over to you, Mr. Ankit. Mr. Ankit, are you there?
Hello, yes, I'm here.
Yeah. Okay. Please on your camera.
Give me a second. Hello.
Absolutely fine. Mr. Ankit, just introduce yourself to the audiences who is watching live and who will watch it later as a video.
Sure. So this is Ankit Gupta this side. Actually, I'm the founder and the director of Space Station Automation at the Chanavan Private Limited. I'm currently serving as the assistant professor at IIM University as well. Generally, I'm working the field of the automation. Automation can be in the different fields, including the civilian as well as the military systems. I've worked in the automation for the healthcare as well. Me and Devashmita together, how will I say, we have had like sessions, like 40 plus sessions for the automation industry and in the different sectors, specifically in the medical and the healthcare sector. And I think that's pretty much about me in a very short and crisp.
Yeah, thank you, Mr. Ankit. Over to Nishita Tole. She is an NLP master practitioner of EFT, that is emotional freedom techniques, and provide technical and practical tools for emotional healings. So over to you, Nishita.
Thank you so much. So as Ms. Basra introduced, that my name is Nishita Protla. I have a very pretty good, decent understanding about the meridian points. So how the energy get blocked, that is the reason it is dis-ease, which was already at ease. So my practical tools that can help the person to get out of it, because the step how it begins is upon the acknowledging yourself with the disease is the first step of the awareness of the disease. Diabetes is due to lot of about lack of sweetness in the person life. That is the reason they get into the disease of diabetes. When the energy of lack of sweetness get out of it, the meridian points functions really very in a very way the way it should be, and the insulins get intact. Then after the person get diabetes free. And I am over here to join my hands with Ms. Basu and all other people. So looking forward to it, I will be giving you practical tools, I will be giving you practical technique and certain affirmations that can help you in a very easy and a peace way that you can get out of it. That's all I'm here about. Thank you.
It's very sweet. Thank you very much. Yeah. Now, all the speakers here will talk on one topic. I'm giving you the topic. So it will be like a discussion. Okay. So whatever you want to show, means whatever you want to discuss, please come forward, because here it is a very important thing, that is in a diabetic day when we are dealing with a lot of employees are getting affected, all people, not only the employees. I'm talking about each and every individual, right? So because as being a digital coach, we are the value provider. So definitely on taking into this, I'm giving you the topic, that is harmonizing the health, unrevealing the genetic links to metabolic disorder, and integrating NLP hypnosis, EFT yoga for diabetic prevention in the corporate world. So if you want, I can repeat the topic once again so that it will be easy for each of the panelists to discuss on this. So yeah, again, I'm just repeating the topic. If you want, just write it down. Harmonizing the health, unraveling the genetic links to metabolic disorder, and integrating NLP hypnosis, EFT. Many of the person who is watching will not understand EFT. Is a freedom technique. Is an emotional freedom technique. Sorry very much. Yeah, yoga for diabetes prevention in the corporate world. So over to you, to the panelists. Yeah.
Since the topic is about unraveling the genetic mysteries, as a geneticist, I feel I should be showing up first. So, diabetes is considered to be one of the devastating diseases of mankind, but with some conditions. Say, when I say devastating, diabetes per se won't make any person into a state of death, except in two conditions. That means very higher level of diabetes, say 500, more than 600 milligram per deciliter of blood glucose. That person can end up in a stage of death or approaching the stage of death due to diabetic ketoacidosis or coma. In another extreme condition is very low blood sugar. That means below 40 milligram of blood sugar in a person's body. That too has happening for a person who is having for a prolonged period with an uncontrolled diabetes, we say. So these are the two occasions where diabetes can end up with death of a person. But we need to understand that the diabetes can be considered as the precursor, I can say the important precursor of most of the other devastating diseases of mankind, say heart attack, say various other diseases related to cardiovascular system, say stroke, say even hypertension, various other metabolic diseases. So this is actually the precursor for various other diseases. And these so-called other diseases can end up with some serious issues, complication in a person's life. So when we think about what exactly is the reason for diabetes, we can say that in our medical text also, this is actually a genetics plays an important role. But as days goes on or pass by, that means now we think that even if we have a bad genetics of diabetes. See, I'm a person working in this field of genetics for the last 3 years. And especially for Indians, we could identify that we have completed around some 10,000 samples of genetic analysis of Indian customers. And we could identify some more than 80% of the people are having one way or other way, they have some genes related to diabetes. We used to check around some more than 24 genes that are responsible for developing diabetes. So in my opinion, genetics, of course, plays an important role, but we all have the genetics. So in this 10,000 people that we have checked, more than 80%, it comes around some 83 point something percentage, people are having these diabetic genes. Only very small amount of people are not having these diabetes genes. So interestingly, the rest of the people, maybe around some 17% of people, and some percentage among these 17% is already having diabetes. See, this is an interesting factor. At one side, we say that it is genetic. At another side, even the genetics actually favoring them, they also having diabetes. Means, in other words, even if they don't have the genetics of diabetes in their body, but they are end up with the condition of diabetes. So I can clearly say that genetics plays a role, but not the complete role in developing diabetes. Let me tell you an example of myself. I have myself diagnosed with a pre-diabetic condition in my 26 years of age. My blood sugar level was around some 130 to 135. That was the range. But right now I am in my 40s, and right now my blood sugar level never increases beyond 100. Okay. So of course, genetics plays a role, because my father had diabetic, my grandfather, my maternal grandfather already had diabetes. So I'm actually living or coming from a family full of diabetic. That means I'm carrying a lot number of bad genes present in my body, in each and every cell. So what I'm trying to convey is, this is actually not a mystery when it comes to genetics and diabetes. We do have, Indians definitely have the genes of diabetes. So when we check in with the genes of various other Caucasian population, especially Russian, the various Spaniards, we do have testing these genetics of these kind of people also. We are amazed to see that those people are actually not having this much amount of bad genes related to diabetes. Of course, Indians have these bad genes present in their each and every cells in their DNA. So is actually, if we think that since it's genetic, we cannot do anything, that's actually a completely myth. Even if you have a bad gene related to diabetes, even if we have many bad genes related to diabetes, we can control, we can definitely stop the progression of getting into the state of diabetes. Means it's in our hand. Even if we have that bad gene, we do have tools, especially our lifestyle. With the correct usage of those tools, we can get into a healthy state without diabetes, even if we are having the bad gene of diabetes. So here comes the role of some other terms that I can say, epigenetics. That means something around the genetics. We all have learned about the double helix structure of DNA and all. So we studied about the DNA, the ladder type structure of DNA. But beyond that, there are some molecules attached to that ladder that we call it as epigenomes. These are actually acting as the keys to open the bad gene, or these are the epigenomes which decides whether the bad gene of diabetes need to get expressed or not. Okay. So once, if you have the correct epigenomes, or if you are actually nourishing those epigenomes, correct nourishment, if you are giving to this epigenome, it will lock those bad genes of diabetes. It will lock those bad gene of cancer. It will lock those bad gene of hypertension, obesity, etc. Let me repeat. Even if a person is having a bad gene of any kind of lifestyle disease, including cancer, if your epigenomes are working it correctly, it can lock those bad genes so that you will never end up with that disease. So now the question is how you can alter, or how you can make those epigenomes into a powerful state so that it will lock the bad genes forever. It is only way is through your lifestyle. Medical science is not that much advanced in case of epigenetics. Of course, it's actually an emerging area in the medical field. Maybe some 20 to 30 years of years down the line, we will be having solution. But as of now, and the years to come, I can clearly say that our lifestyle plays an important role in these epigenomes. Epigenomes are those chemical molecules found outside your genes, outside the ladder structure. This is actually the deciding factor for your genes, bad genes, whether it needs to get expressed or not. So your lifestyle directly correlated or directly affect this epigenome. So your emotional factors directly affects your epigenomes. Your environment directly or directly correlates with the epigenome. So in a nutshell, I can say your lifestyle, your emotional health, your sleep, your diet, your exercise, all these factors are actually affecting your epigenomes, which will help in turn to suppress your bad gene of diabetes. Even if the bad gene of diabetes has expressed, that means the person is having full-blown diabetes. We can correct the epigenome, but it will take some time by correcting your lifestyle, not exactly like taking just in a regular timely food. It's depend upon various factors. When I say lifestyle in a single word, it constitutes a lot of factors. It constitutes your sleep, it constitutes your diet, exercise, emotional health, your relationship, your environment that you are living. All these factors plays an important role in deciding how the epigenome should be acting, and this will decide whether the bad genes need to get suppressed or not, which will definitely deciding whether the person is actually going to have diabetes or not, whether the person is, if the person is already having diabetes, whether the person is going to into a remission state or into a very aggravated state. So let me conclude in this way. Even if we have the bad genes related to diabetes, that's not the end. You can take charge of your life through the exact key which is deciding these genes, that is epigenomes, through your lifestyle, through your sleep, through your emotional health, etc. So when it comes to diabetes, managing or preventing is mainly depend upon these lifestyle factors and environmental factors.
Thank you. To keep the thread on, I would request Subha Vahini to come because she is also a diabetic coach. And then to keep the pace on, I will request Rahul to come forward, and then Nishita, and then Ankit. Okay. Yeah, thank you, Dr. Biju. It's a very nice explanation which you have given. Yeah. So please follow the thread. Yeah, Subha Vahini.
Thank you, Debasmita, and thank you, doctor. It was amazing. You've covered everything, and this is the confidence that you're giving to everyone. And yes, as doctor says, if parents are diabetic, is it necessary that we have to become diabetes? Right? Definitely, genetic plays an important role. And doctor explained it in a medical terminologies in detail, but I just wanted to add, tell something, like ask you a question. There is something called risk and there is something called fact, right? There is something called risk and there is something called fact. When we are talking about risk and when we are talking about fact, which one is more dangerous? Which is more dangerous? I just wanted to ask, Debasmita, please tell me whether the risk is dangerous, or I'm a project manager, so I'll be talking from this.
Fact is always dangerous. Risk is not. Risk we can take. Facts, when we are going to the facts, we are taking those. This risk comes. So risks are not.
Okay, I'll put it in a different way.
Yeah.
Here, fact is that I have the genetic predisposition. My parents are diabetic, my mother is diabetic, my father is diabetic, so I am having that gene. This is the fact, right? Risk is my parents are not diabetic. But as doctor said, even if your parents are not diabetic, if we don't have genetical predisposition also, we can have that chance of getting into diabetes. Now, whether the fact of we know that we have genetic predisposition, whether that is better or risk is better, fact is better, right? Always. Risk means we don't know. So when there is genetic predisposition, definitely there is chance that we will also get into diabetes, or we will get into, if we are already diabetic, and we may get into complications if we are not really following our lifestyle properly. But the fact what we have is, there are two genetical things I can talk about. One is physical, biological genetics, that we carry the gene from our parents, right? We can never escape from that. We can never escape from that. Chances are really, really high when it comes to biological genetics. But there is something called social genetics. The social genetics is the important factor why doctor said India, we have definitely, everybody have this genetical, the gene of diabetic. All of us, you have, I have, because of this social heredity. What happens is, I follow my father, I follow my mother, whatever she does, I'm following. I don't utter a single question why this custom is being followed, right? Especially while celebrating festivals like Diwali. We just celebrated Diwali, and from the beginning, only thing we have transferred is sweets. We don't know why we are actually eating those sweets or distributing those sweets, little sweets, and we just follow the tradition just for what do you call custom, right? And this social heredity is something that is impacting all of us. Even if we have genetic predisposition, if we are so cautious about our lifestyle, so cautious about our social heredity and what we are doing, if we are ready to change ourselves from diet, exercise, and mental thing, definitely we will be able to succeed the challenges that this biological genetics is giving us. That is what I believe in. But one more challenge is it possible for us in today's working culture or today's lifestyle, is that so easy to follow lifestyle, whatever we are talking about? May it be diet, may it be the diet, whatever we are saying, we say low in carb, add lot of generous amount of vegetables and just lot of protein in your diet. But is it really possible when it comes to practically applying it in our lifestyle today? It is not, because there are two reasons. We don't have time. That is one biggest thing all the employees, working professional have, is I don't have time to think about it, prepare it, or I don't have time to manage doing this, right? Second one is availability. Today, anytime, anywhere, you get any kind of food that you want. Even in the night, you get this. In South India, biryani is something like we crave for, right? Night, late night, midnight, people get these non-vegetarian biryani and have it. And they don't mind, or they don't have the awareness, how is it getting digested first? Without having this awareness, the pleasure, enjoying pleasure is just going beyond our control. We are living today for this pleasure, enjoying the pleasure sense only. For example, we just want to see everything bright. We just want to enjoy everything through our eyes. We always wanted to enjoy through our ears. We just wanted to enjoy. That's it. And taste is one of the important factors. And taste is actually dominating us. Those days, only during festivals, we used to have these kind of sweets. But today, sweet is available for all of us in every place. And we just wanted to have it every day. Taste food. So these kind of factors, there should be some awareness given. And the health awareness is very, very important when it comes to diet and sedentary lifestyle. Sedentary lifestyle, People say, how much ever I say, like 1 hour once, just have an alarm in your mobile phone, wake up, get up from your chair, just walk around and come. People say, I don't have time, or I'm not so conscious about it. We are not conscious about ourselves. That is one important factor. And one more mistake people do is, especially the yoga professionals like me, I should say this, early in the morning, I do 1 hour yoga. And when it comes to during the day, I just sit sedentary for 10, 12 years, 12 hours. Just practicing 1 hour of hardcore exercises and just sitting in the sedentary throughout the day is also really not good when it comes to especially diabetes as well. And third important factor I wanted to talk about is the emotions. I want to share one of the case study or one experience which I have shared, which I have had with one of my clients. I was working with this lady. I don't want to mention the name, though you don't know her, but I still don't want to mention her name. She was working with me. She was doing her exercises. She was doing her fasting. I mean, sorry, not fasting, dieting. Her diet was like very rich in protein. Everything was perfect. She was doing it, taking a lot of effort. Still, it was about 6 months, her HbA1c level was not getting down. And HbA1c having beyond 10 is very critical. It's beyond control, right? So what happened is, it was not coming down. She was also taking medications. That is the key. She was also under medication. She was having the diabetes medications. She was consulting the doctors, and also she was taking the lifestyle coaching from me. 6 months, nothing happened. One day we were doing this deep relaxation exercise in person in my clinic, and what happened is, she started crying immediately after that deep relaxation. When I asked people to wake up, she was crying. I immediately sent all of them and made her sit and open up. She's saying, women in India, they are not able to speak out many things out, and lot of emotions are suppressed within them. And she has some very, very sensitive thought about her husband in her mind. She's not able to speak out, or she's not able to question that out. And this kind of suppressed emotion is really disturbing her, which is disturbing her HbA1c level as well. I am not a family counselor, or I can't do this, right? There are people for it. So I sent her over there along with her medication, along with our thing. And she also undergone the family counseling. Then in 2 months, HbA1c level started dropping. And now her HbA1c levels is like around 6 or something like that. So that was really shocking for me. Even us, many of us just neglect the emotional thing which we are facing as well. This is one important factor we will need to give a lot of attention to. So, conclusion, as doctor said, genetics, yes, we will have genetic impact. No doubt about it. If our parents are diabetic, definitely we will have our parents' gene. We may get diabetes anytime, or our diabetes may get into complications. But we have another tool in our hand, that is our environment. Our environment is nothing but our internal and external environment. What we eat, how we keep ourselves active throughout the day, and how do we treat ourselves within us. How do we treat ourselves? How is our self-image basically? More than stress, more than emotions, I would say, are we really treating us well? How are we seeing our self-image, our mirror? That is important when it comes to managing diabetes. This is, in fact, the first thing we will need to look while working on diabetes. If we are doing this, we can succeed the genetical factor as well. Thank you. Thank you so much.
Thank you. Oh, to you, Rahul.
Beautifully said, Shubhavahini. I must say that as I kind of like sent out that intention at the beginning of today's panel discussion, right? That this is in service of those who are watching now and of course later. Not only what you said, especially this one point really struck home for me, which is all about social heredity. So there is one part, of course, which is epigenomes and how Dr. Biju talked about it from a medical perspective. There's also the social construct or the social perspective, which is so powerful. And I'll kind of use that as our segue into something that I know that I can, not only when I say talk about it, it's something that I've studied, it's something that I've observed in people for many, many years. And, like you very rightly said, especially in a country that is, centuries old, when we talk about social norms, when we talk about culture, like we truly do have culture, unlike a lot of countries across the world. And of course, it has its positives, but there's also the flip side, which is, like you said, a simple thing. I say simple, especially because this is like hot on the heels of Diwali just wrapping up. You can probably still hear crackers where you stay. I know I can here as well in Bangalore. But the point is this, right? Like very, very rightly, there are a lot of rituals that we still follow today without really either, questioning it or revalidating it in the present context. And since we're talking specifically about diabetes, and when you ask the person on the street, when you say diabetes, what's the first word that pops into your mind? It's usually sweets, right? So we'll sort of like use that as a softball. And when we're talking about, one is of course controlling sweets, but if we go a little deeper, and I love the sharing of what your client experienced when you led her through a process, because I understand that language the most, right? And I kind of sense what could have happened for her to, one, quieten the mind, to go within. And in that one moment, obviously, it was also a lot to do with your care. You're working with her already for 6 months. So there was that, that environment of trust that was built in, where she was able to go within. And this is where, when we talk about diseases, especially today, when you talk about diabetes, you consider it to be a lifestyle disease. So one thought that came to me was, like you mentioned something about not being conscious about ourselves. There's a reason why most of us are unconscious when it comes to ourselves, right? On the face of it, it's like saying people in their 20s, typically, and we've all been there in some form or the other. We tend to drug ourselves, knock ourselves off. As we get a little older, things change a bit, but not so much, right? And so it's very easy, especially today, in this world, like you said, one is the availability of sweets, of food, let's say sweet, rich food in different forms. That is one part. But it's not only that consumption, it's all forms of consumption today that we have so much of access to that is sickening us. Now, in all of this, if you were to say, okay, how do we treat ourselves? If that's really the question, then the answer also lies in the question itself, which is we have the ability to be able to treat ourselves differently, provided we are willing to ask that most important question. And that question is, how? So if you think about it, most often people do not make lifestyle changes because they don't know how to do it. And a lot of times, all well-meaning professionals, including ourselves, we may be prescriptive But unfortunately, that's a one size fits all, which doesn't fit all, right? So this is where I have been very fortunate to have noticed that it does take a lot more care, but the training of the mind is more in the context of basically, getting people more connected to, like, why do you really want to change, right? In order to figure out how am I going to change, the question is not how am I going to change. The question is, why do you want to change? Why? Because again, you use the expression of social heredity. It comes in different forms. So basically, it's an easy way for us to do what is easy, right? If it's like saying today people have become aware of being gluten, intolerant, amongst many other things, which it's like sometimes you'll hear people maybe 1 or 2 generations older than us saying, oh, but in the 80s, we never had this problem, right? People didn't have allergies, people didn't have intolerances, and so on and so forth. But in the last, 40 years, sometimes you don't realize it, but it's been 40 years since the 80s, now closing on to 50. We a lot has changed in the world today. So, when we're, and again, this panel is designed not just for our benefit, but truly for the benefit of people watching this. And so this is my question to each of you out there, right? If you start to ask yourself the question, why? Why do I want to change? Because remember, change is hard initially. Change is difficult initially. Change is painful initially. And even as practiced professionals, even as educated professionals, we ourselves know there are phases in our lives where we let go. There are phases in our lives where we are not our best selves. And yet, because of our intention, because of our training, we're able to right the ship. Because again, if you really think about it, one of the reasons why each of us are professionals is because we truly want to make a difference in the world, which comes back to a very core question, which is, why do we want to change? It's like, out of what I've said so far, if you just take this one thing away with you, which is to ask yourself this question again and again, which is, why do you want to be your better self? Why do you want to change as a person? If you're able to keep checking in with this question, I can promise you this: 6 months, 1 year later, you'll probably remember one random panel that you happen to have seen on YouTube, because we are in an ocean of information today, or maybe somebody sent it forward to you. But just remember this: if you allow yourself this question, which is, why do I want to change? Then your life will start to simplify. You will find the right professionals, whether it is in a medical context, whether it is in changing your lifestyle, whether it is in changing your core being in a way which is in alignment with something that's much bigger than you. Because remember, we have all been sent here for a much bigger purpose. It's just that most often we forget. Most often we get caught up in the day-to-day, right? So in closing, I'll just say this. Every time, you ask yourself this question, why should I change? Right? Or let me put it this way. Every time you ask yourself this question, how should I change? Stop and ask yourself the question, why should I change? If you do this, I can promise you this: a year from now, you will be thanking yourself. So with that, over to you, Nishita. You're not audible, Devasmita.
No, you're not audible.
Thank you so much. I hope I'm audible enough. I'm audible? Yeah, fine.
Yes.
Thank you so much. Okay, we have got deep insights of all the diabetes issues and everything. Now I am going to hit my EFT, that is emotional freedom tool, where you can actually get into your Mediterranean points to get out of diabetes. Now, this is a tried and tested tool. This should work like a wonder. So, everyone starts from karate points over here. Okay. Now, this is the Mediterranean points. but I usually starts from the collarbone. So you just need to 3 times round it out, okay, and acknowledging the issue. So you have a diabetes, right? And you want to get out of it. So first step always become with the acknowledging. Second is love and acceptance, and third is the affirmations which you have. Okay, so diabetes is actually associated with longing for what might you have, a great need to control them, and there's a deep sorrow, and there is no sweetness in your life. So rather than going for the sweetness in the food, add sweetness in your life. In a time when there is a lot of love and there is a lot of sweetness, at that time the energies get released of bitterness. So when the sweetness is being added, the mindset shift. So first, it's a thought, and thought can be shift again and again, repeating it again and again, repeating in front of a big mirror. If whatever you have, your cupboard, which is the biggest mirror you have, just go in front of me and lock yourself in the for a few minutes also. So I'll just start it. Yeah, the tapping tools like this go start over the collar is there. Below that, you just 3 times circle it. Then next is over here. Then next is over here. The third is over here. Fourth is over here. Fifth is over here. Sixth, seven, and then below the chest you have one abdominal part over there, and then to the left and right side. Each this part you need to tap 7 to 8 times. Now this is a tapping technique. This helps to release your energy and help to shift your mindset. When the tapping goes on, you actually there is an inner chatter of the mind. Okay, when you say it loudly, the inner chatter of the mind gets stuck. When the inner chatter of the mind gets stopped, the conscious and the subconscious start connecting themselves, and the alpha level, you reach at the alpha level. This generally happens when you go to sleep. And that's the reason the affirmation works like wonder. When it has gone to more deeper level, it is at that stage, it's a theta stage where the hypnosis happens. It is a stage when you sleep, okay? And when you sleep, and there's such a deep level of sleeping where you know you're just about to sleep and your eyes are closed, your body is completely relaxed. At that time, if you affirm anything, the mind, the conscious mind have gone to the sleep, the subconscious mind have to obey you. This is the way the things happen. Now, hitting to the tapping, the first thing is that it is acknowledging what is the bitterness is there in the life, what is eating you within. Whatever is the problem, just start tapping it. So something like this, I'll go that there is a lot of bitterness. I am sad due to such kind of a reason. There is a lot of sorrow in my mind. So it's 7 times. I'm just getting a bit short because I need to cover more tools out of it. So this is a lot of sorrow in my mind. I don't know why the reason I am going to this disease. Is this the life is being unfair to me, or I am being unfair to myself? Why I am going through this thing? There's a lot of anxiety into it. The bitterness I have, the thought process is such being attached to me that I'm not able to get out of it, though I want to get out of it. In the chest level, you can go more of that tapping because might be your own people have betray you. The office colleagues which you are going around the corporate life had made you in a certain way which you are not. So might be because of those, the emotion are stored in the heart. The pain is a lot of there in the heart. So tapping works on that. And thereafter, as all these things are covered, when you feel there's a lot of things which is coming out, take a deep breath and release from the mouth as if a black gas is exhaling from your mouth like this in the top of it. This helps to open up your chest. And then you go down over here like this, over here, use here over here. Now this is actually the area, okay, in your body where you can release the most light because the breathing don't go most of this time. That is the reason you get closed down. When you open it, you feel like yes, it's working, and then to the side of the breast and come again over here and see whatever the sorrow is going on, the whatever you're holding for a longer period of time, just continuously go on it. And thereafter, second thing is I love myself, I accept myself. I love myself, I accept myself. I love myself and accept myself. 7 times all the tapping. The third is go the reviving part. As there is a lot of cleansing done, emotional freedom technique, EFT, as there are a lot of emotion that's been released, this emotion which has been sabotaged, which has been released. The love and acceptance is given to you. The third goes actually the affirmation part. Now, for the diabetes patient, Whomsoever is the suffering, the affirmation is the moment is filled with joy. I now choose to experience the sweetness of today. This is the affirmation. Before going to night, if you can affirm it, work like wonder. Don't think how it will work. Okay? Logic should work. That is the reason before going to sleep, you need to do that. And spend some time where you can actually you feel joyful, which is a singing, doing any activity. Sweetness is a thing which comes from children. A child is very sweet. Below a 5 year or a 3 year child, you can actually spend the time with that child. When you experience the love, the happiness, the joy, and that sweetness from the small child, the inner child which is being died due to this emotional baggage starts awakening. And here the emotional pattern change. Over here, the cells which were actually being caught up by the emotional baggage start to decline, because every cells we are having a 60 trillion cells according to the researchers, and we have this huge amounts of cells which are being caught up due to lack of sorrow, deep sorrow. This eventually dies, because it's a cycle which constantly change. As the age is going up, the cycles of cells also die and the new cells comes up. So as the old cells will die, the information is being passed to new cells. So if you affirm to it, and if that cell is not able to actually give that output, it will pass to new cells. And when the new cells will come, which is giving you joy, which is giving you sweetness in your life, the diabetes will eventually be go off. And this is for any emotional baggage you have. The second technique, apart from EFT, is the water bottle technique. Can you just see is I have using this technique for a long while. Now, this is a simple exercise. Okay, anyone can do for anything. It's for diabetes, for the stress, or anything. This is very true that we live in an era where we don't have actually time for ourselves. We have so much of work to get caught up with ourselves. What if you use one water, attach the affirmation, which I'm going to repeat again? The moment is filled with joy. I now choose to experience the sweetness of today. You can stick that affirmation over here. Okay. Just use the sellotape to cover it. Drink it. When you drink it, you feel it. When you actually feel it, okay, the thought and the feeling changes. So you need to drink at least 2 liters of water every one. Ideally, it's 3 to 4 liters, but actually we drink only 2 liters. So whenever you drink it, you feel it, because we are water bodies. The 70% of the planet Earth is covered from water, and accordingly, we are also, if we can't drink water for more than like 7 days, we can eventually die. Okay, so keep yourself awake with the water, and water helps you to get lot of things. Water have a very powerful energy. So if you take this thing, you can actually it will work as a law of manifestation. When you feel it, actually, the old cells will eventually die. The new cells will come into it, and that is also one of the strongest way. The third technique which I would put on the table over here is visualization. As I'm an NLP, neuro linguistic programmer, I will just give you the small visualization technique. Just close your eyes, okay? Whosoever is a person who has given you deep sorrow, lot of bitterness, you are holding that person for a longer period of time. Just bring that person in your mind. Close your eyes, just bring that person in your mind. Like a black ball, the person is going away, 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 away. Convert that whole situation of the person in the black ball is going away, 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 so much far that you can't see it. When you can't see that person, the black ball will disappear. And bring your God, whichever, Allah, Jesus, Ganpati, Shivji, whatever you believe, have a lot of faith in it. Belief works like wonder. When you believe it, it actually happens. Bring that person. When that God is there, ask for the things which you are actually demanding for. You're working for the diabetes, right? Just ask the person to get, ask that God to get out of this. When the silver shining light will come from the God, actually absorb that energy, when it has been absorbed in your energy, there's a lot of things you feel like there's something feeling. You have some feeling in the body. That is the meridian points. At that time, the cells have a power which they get absorbed. Mirror work, whenever you go to the mirror, just do that. I'm adding a lot of sweetness and I have a joy, and just go about like this. Yes, I've been having a lot of joy, because when the body is getting open and there's a self-talk is getting replaced in the front of a mirror, okay, you love yourself, you accept yourself, and that time the magic happens, because love has a really very high vibrational frequency. So everything is energy. If the energy is changed, the frequency is changed, and thereafter you're out of any disease in your life. That is my third thing which I would give you to you. My fourth and last but not the least is journalizing. Eventually, we don't have everyone who can understand us in your life. Okay. So here is the realizing exercise. What is the thing which is giving you deep sorrows? What is the thing? How you will do that? You will take a book, you will take a pen. First thing is list all the things you are willing to let it go. Those sorrows are past. You always clean your house. Now it is time to clean a mental house cleaning. So always list all the things you're willing to let it go. Answer that question. Second question is, how willing are you to do this? That is your why, which Rahul has rightly prompted. The why is really very important. When you have a certain reason to get out of it, now at that time the how will come to the place. The dietitians, the all the people will come to the place. There are small things which comes in a way. You need to grab those things, and you are actually going to the way you were wanted to. Okay. The third is notice your reaction, because when you write now, you think lot of thoughts are coming out of the way. So when you notice those reactions, what is the feeling is coming out? Just write that. So this is the third question. Fourth is, what will you have to do to let this thing go? What you can do to let this thing go? Cry over it for a longer period of time. You can cry for the one day, you can cry for the second day, for the third day, fourth day, even mind will say, अब और कितना रोना बचा, मेरे पास कुछ बचा ही नहीं है आंख में आंसू दिलाने के लिए. And at that time, when mind becomes so, it becomes easy for the mind to let it go. Na? The emotional baggage releases. The next question you need to ask yourself is, what is your resistance level? How you can bear it? How long you want to bear it? So be very truthful how long you can bear it. If you can bear it for a longer period of time, the mind will say, yes, I can bear it for a longer period of time. Your conscious mind will say, are you mad? What are you doing this? No, but that person have did wrong to me. Because of that, I'm here. So the conflict of interest will come every day. And that is the reason the cells will get confused. And when you do EFT, which I've just shown you, we can go to the recording and do as many of time as you want. When you do that, the self-talk, the things will start changing. And here are the final my tools and techniques which I've given you. So I'll just summarize into it. First is the EFT. Second is the water bottle technique. Third is the mirror work, which we get. Affirmation before going to bed. The visualization part. And the bonus which I gave is the resistance. So when you journalize whatever is going into your mind, when you write every day, it became very easy for the mind to put out of all these things. And when you get out of this disease now, when you actually cross certain ways of it, when you regularly do the blood test, when you get out of this, when you see the blood report, the belief systems works. अगर ये इतना हो गया ना, इससे भी आगे जा सकता हूँ. And this way the emotional baggage would go away, and you can leave the right to the present moment. I hope I have added as much as I can be very value adding to you people. And this is something I just want to say, that everything can change in this life, because we have 80 trillion cells, and we have a neurons which works like a wonder. Dr. Howeker in 1949 said that neurons that wire together fire together. You need to build the new patterns which can rewire your neurons. That is through going before the bed. You need to be a different person. When you become you are a better person, you need to become a sweet person. That is an identity shift. That takes time. According to researchers, 66 days it takes to build up a habit, build up a pattern. But that 66 days Trust me, it's not that easy. You will fall, you need to get up, you need to start again. Dust off you're back, get again. And one day, I think there will be the time when you will be telling others, I was a diabetic patient, now I have cured due to this thing, and you will be motivating others. That's all from my end. This is Nishita Tuzla signing off. Until we meet again, over to Ankit. Thank you so much.
Yeah. Thank you very much. Thank you very much, each of the speakers. And Ankit, what you said was since it's 9:25, so just come for 5 minutes. Uh, Tell about what you want to say, and I would request Rahul to just to conclude the whole thing. Yeah, with within 5. Ankit, are you there?
Yeah, hello. I'm really sorry. I think sometimes my internet is not very responsive. So though, uh, we had a good discussion about like what can be the possibilities of how will I say the EFT for the yoga and diabetes prevention. Most importantly, we can see people at the age of 30 and 30 plus, they used to have the diabetes as a problem for them. We may can see the people at 50s and 60s, they're still living their life very easily without having diabetes, and there are some people who are in the very early age, they can actually get the diabetes. It's obviously a very difficult kind of situation to understand like why these two generations having these, one which is having the diabetes and the other which is not having the diabetes, and there is a huge age gap between both of them. Most importantly, it may can be obviously because of the genetics, and otherwise may can be because of the eating habits, or maybe the habits which they are having with their daily life cycle. uh, like discussing all that plays a very vital role in our day-to-day life. We are moving towards the technology, and we are more dependent on the technology to simplify our daily task. We personally feel that going to gym is going to be enough for us. I personally feel that this is not the real case scenario. You definitely need to do the similar tasks which our ancestors used to do, and they used to stay healthy and stay away from all these diseases early in their life. So from my point of view, I personally feel that whatever we have discussed in our session today, it is going to be really really supportive to these people who are able to generate these kind of diseases at the early age, at the very early age in their life. To actually prevent these, you need to be staying healthy. Not just healthy, I will say there are three different scenarios which you have to prioritize. First, obviously, staying physically healthy, mentally healthy, and third, that is the most important, which is emotionally healthy. We have discussed about like we have to how will I say uh, do the affirmations on the daily basis while staying up like in the early morning and while going to the bed. It allows us to relax our brain and our body. So yeah, I think that was the most important part about the entire session which we had today. Over to you, Devashudaji. Hello, am I audible?
Yes, yes, yes. Thank you, Ms. Ankit. And because of the short of time, I would request Rahul to just come forward. Yeah, and please give the conclusion. Rahul, please over to you.
Okay, so on that very um poignant moment for us to all just take a moment, take a breath, and firstly, of course, big thanks to each and every one of the panelists who've selflessly given of their time and discussed not only the medical aspect of how you can start to make changes in your life, but also the social aspect, as well as very, very powerful techniques that you can use to make a difference in your life. I think at the end of the day, when we talk about any disease, and in particular when we talk about diabetes, the good news is that it's not a full stop. It's more about us taking a breath and realizing that we may have been led to believe that diseases are permanent, and that you're kind of like in the old days they would say you have been you have a, what is the word they would say, kalank, right? You have you have been cursed with certain illnesses. But the good news is that with the right amount of attitude, the right amount of people that you reach out to, resources, your life can truly change. So I want to wish each of you on your journey as you're watching this, and whether you're watching this now live or whether you're watching this later, remember that your life is always getting better day by day, breath by breath. And with that, I think, as they always say, ladies first. So I'll hand the baton over to Shubhavahini for the last of the last one. Go for it.
Thank you, Rahul. When you were saying like it is not the full stop when you have diabetes, why I've taken this last person's ticket over here from you is I want to end with one important message. World Diabetes Day. Today, November 14th, every year is being celebrated as World Diabetes Day. To give awareness on diabetes, this day is being celebrated. But every World Diabetes Day has a theme. And today, for this year's theme, it is Know Your Risk and Know Your Response. That is the slogan actually for World Diabetes Day 2023. That means, as Rahul said, it is not a full stop. If you know your risk and know your response, if you're prompt, working on your response immediately whenever you're getting to know your risk, then diabetes is just an easy game to play with. We don't need to, but just be aware, be scared of all the diabetes complications, because diabetes, I say it with fun when I go to my workshops. We don't live in joint families, but diabetes is kind of a joint family concept. If you get diabetes, you will get a lot more other associated things joining with you. So there are complications associated with diabetes if you're not managing it properly. But it is very easy to manage it properly if you are being aware of your risk and if you're being aware of your response. So information is overloaded. Don't just get into those kind of informations. Just be with your doctor, with your proper diabetes educator or the nutrition dietitian, whoever is helping you, and follow one path. Even if you're doing one simple thing, a good habit, just follow that consistently for some time and that will give you the result. This is what I want to end with. Thank you so much. Thanks, Debasmita, and thank you everyone over here.
Thank you all.
Thank
All the
you.
best.
Yeah.
Take care.
Yes. Bye. Thank you so much for giving your valuable time. And yeah. So yes. Yeah. And to those who are watching this, please share your learnings below the comment session. Yeah. So we are coming again live. Yeah. Bye. So if you want to take a photo, Dr. Biju here, and Rahul, just please take the photo.
Rahul, you have to help us take the photo.
So it's pretty simple. Hit the reaction button below. And
all of you can hit the reaction button.
There we go. Ready when you are, in 3, 2, 1. Nice. Perfect.
Yeah.
Take care. See you guys.
See you.
Got to rush.
Bye. Good night, all.
Bye. Bye.
Thank you.
Good night.
Thank you,
Good night,
everyone.
doctor. Bye.
Thank you, Dr. Vijay, Dr. everyone. Yeah.
Thank you.
Thank you. Thank you all.
Thanks.
Yeah. Thank you. Yeah. Good night. Yeah. 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 Thank you.
Thank you, Devasmita.
Thank you, Nishita.
Thank you, Devasmita. It was so
Thank you.
nice.
Thank you. Yeah. So.
To talk to you. I'm so sorry in the time I trouble.